Yo, what up? It's a tip of the week, and today we're going to discuss indications for tori removal.
If you love this tip and want to go deeper, check out this course. I can describe this course in one simple phrase: surgical coaching in your office. Concierge Surgical Coaching is a PACE accredited with the Academy of General Dentistry. This course offers an innovative approach to surgical and implant dentistry that can help you achieve your goals. Concierge Surgical Coaching gives you affordable prices, hands-on training, how to handle complications, step-by-step methods for best results, and how to discuss patient finances and your return on investment. Gain the skills you can use now on your patients for tomorrow that could achieve your production, clinical goals while never booking a flight for education again. Start earning CE today. Enroll at jaredwdds.com.
Well, first off, let's talk about what the heck is a tori or a torus to begin with. Tori is just a benign osseous growth. It can either be found in the palate or it can be found on the lower jaw. Sometimes it has another name called exostosis. That's basically where there's bone that is found in the buccal region of the jaw, upper and lower jaw. So that's all it is. It's just extra bone. Simple. It can recur. Make sure you let your patients know that if it were to be removed, they can reform. Most of the patients that I've treated, they haven't come back, but it doesn't necessarily mean that they will not come back. So just keep that in mind. They can reoccur. Other thing is this, they're found more so in men than women. So that's another thing to also take in consideration. All right, so what are the indications that you should be looking for if you have a patient of yours that has to get their tori removed? Well, number one is this. Can they eat? Sometimes patients, when they have tori, it impedes their mastication functions and just them being able to have regular, normal eating patterns that sometimes we take for granted on a daily basis. So that's something. Number one, can they eat? Are they having a hard time? You know, I had a patient who I was planning on taking out her tori, and she was just like, Doc, I need you to take these out. I'm like, well, can you modify what you're doing? She's like, no, I just like eating chips. And every time I eat chips, it kills me. So hence her tori were removed, and we did it pretty successfully without any results. And she actually healed very quickly, actually. So just keep that in mind. Another thing is this. Can they maintain their oral hygiene? If you look at some tori, they can be so massive that oral hygiene is significantly impacted. Also, their talking can be significantly impacted. It's kind of like when they're talking like this, and they might not even know that they're talking like this, and you think that there's something wrong with them, but they just got tori in the mouth. So keep that in mind, and don't take that for granted, and listen to your patients, because they're going to let you know what they want. And when you listen to them, they're talking like this because of the tori. You want to make sure that you jot that down and keep that, be aware of that. Also, you want to also take in consideration is this. Are they going to need a removable appliance? Now, if you're a dentist or not, you will recognize you probably won't even recognize that there's bone in the top of your mouth of your patient. But if you're a doctor, generally, hopefully, prayerfully, you would see that something out of the norm. But if they have a tori in the palate of their mouth or the roof of the mouth, it's going to be very challenging to wear an upper prosthesis. It could be a partial denture. Sometimes you'd have to have it modified, or upper denture probably won't even be successful because the amount of suction that's needed to hold those in. It's already hard to have a complete denture that sticks in without any challenge, but think about a big rock sitting at the top of your palate and you're wanting to have the patient keep their prosthesis in. It's just challenging. Also on the lower as well, sometimes I've seen tori about the size of my thumbs. Yeah, I've taken some out that about the size of my thumbs that are just bulbous, and there's no way you can put a prosthesis in. And even if you do get a prosthesis in, taking it in and out can be a bear. So those are certain things that you want to take in consideration. If they can eat, if they have issues, don't have any issues speaking, if they're able to keep their teeth cleaned, if they don't need any prosthesis, then you could probably get away with it. But if they have those issues such as eating, keeping their mouth clean, they need a prosthesis made, it's a good idea to go ahead and get those tori or that bone removed. So there you have it. Those are the indications on if your patient needs tori removal. Hit the like button, press subscribe, and please put some comments down below. Once again, I'm Dr. Jared Williams, and my focus is for you to smile after surgery. Make it a great one.